Hello, welcome to another episode of Business Secrets Revealed. I'm your host, Sonda Yunus. Thank you for tuning in today. With me, I have a very special guest. Jamie Ulmer is the CEO of Heart of Florida, which is our health department here in Ocala. Jamie, thank you for being here.
Thank you. Thank you. I'm very excited about being here, Sonda.
Awesome. Could you please tell everyone a little bit more about Heart of Florida?
Absolutely. Heart of Florida Health Center is a federally qualified community health center located here in Ocala in the Marion County. We've been qualified as a health center since about 2009, so about 10 years that we've been designated as an FQHC. We are responsible for seeing all patients, no matter your ability to pay. And it's been a great 10 years, and we're actually celebrating our 10th year this year.
That's awesome. When?
Actually, June will commemorate our entire year of 10 years. Starting about August, we started celebrating, and we'll celebrate it all the way until June when we move into our new building next year in June.
That's really cool. Where is your new building going to be located?
Our new location is going to be located on 40, Highway 40, that runs on Silver Springs Boulevard, off of Silver Springs Boulevard, and it will run all the way down to about where it used to be the old Albertsons location. And so that entire shopping center, we actually will be obtaining that 68,000 square foot building.
That's
and
huge.
Finishing phase one of it will finish around the June timeframe.
That's perfect.
Yeah, we're very excited about it.
I bet. How many providers are you guys going to be able to fit in there?
So the model that we're actually going to be doing is more consolidating. So we will move our maternity location, our pediatric dental office, and some providers from our central location will all consolidate into that one location. Also, currently our administration is in the SunTrust building, and so we'll move from that building to that site as well.
Okay.
And when it's all said and done, we will save about $25,000 a month in leased space.
That's huge.
Yes, very much.
Saving taxpayer dollars.
Absolutely. And it'll be one-stop shopping,
Right.
which is somewhat of a new model to medical.
Right.
When
Kind of like a medical village.
Absolutely. When you come in with your family, one can go to the pediatrics, one can go to the dentist, one to maternity or women's health, meet back in the lobby to the pharmacy, receive your prescriptions, and check out and leave. And so we really like that model. It decreases barriers to access.
Right.
It allows people to come in and feel more at home. So
that's awesome. And you guys are still keeping the other location?
Absolutely.
Okay.
Our internal medicine residents will still remain in that location, where we'll still see patients there like we currently do.
And that one is on First Avenue by First?
That one is located in what everyone knows of as the S curve.
Okay.
Yes.
Got
still
it.
say there on First Avenue.
So what are big plans? This is already a huge plan. Anything else on the horizon?
There are a couple of things that are on the horizon, some of which I can't disclose yet.
Okay.
But we're looking at also increasing our access with Medicare patients, patients that are in great facilities like the one we're currently in.
Yes.
So we're looking at that as well as we just recently signed an MOU with Head Start.
Okay.
And we will start seeing all the children or a lot of the children that currently are in Head Start.
Yeah, that's really cool. Okay.
Yeah, definitely.
So to kind of get back to the show, which is Business Secrets Revealed, over this time period that you've been doing this, and how long have you been in this position?
I have actually been in Ocala as the CEO for Heart of Florida since January of 2018. So I'm coming up on my 2-year anniversary.
So you're still a newbie.
I'll take that claim.
What were you doing before?
Actually, I worked at a federally qualified community health center in Aiken, South Carolina.
Gotcha.
And so I worked there as their COO for about 4 years prior to coming here.
Okay. So. Any big differences in between how they operate?
Well, the truth of the matter is FQHCs are very similar, but each in different geographical locations operate differently.
Right.
And so we fall under the same guidelines under HRSA, but we operate based upon the demographics and the geographical nature of that particular community.
Right.
And so there are some differences, but overall, our mission is the same. We did the same exact thing there as far as seeing patients, regardless to what insurance, regardless to your ability to be able to pay.
Right. Yeah. Okay. So over your whole career, not just here, what would you say has been one of the most successful ways that executives or business owners or just businesses in general can grow and can succeed operationally and financially? What are the secrets?
That's a very, very interesting question, Sandra, because in today's world, you cannot be resting or sitting, waiting. You have to be able to think very progressive, savvy, outside of the box, and make some sometimes risky decisions, but you have to lower your amount of risk and be willing to have the courage to step out there and make the decision. If I could give you an example of that.
Please.
We noticed this year that our health insurance was going to increase by 18%
Okay.
for what we provide to our employees.
Right.
Well, that 18% was a difference of about $75,000 a month to about $110,000 a month.
That's a lot.
And I'm not going to mention the particular insurance company, but I knew that that was something that was not sustainable for us.
Right.
And so because we have some of the greatest providers, I believe, in town, we decided to go partially self-insured.
Okay.
And what that means is that our employees are allowed to see our own providers.
Right.
We were able to cut our expenses in the healthcare for our employees almost by 75%.
That's huge.
That monthly bill went down to approximately about $35,000, $40,000 a month. But it's a huge risk.
Yeah.
What if someone needs a heart transplant?
Right.
However, based upon the health and fitness of our organization, I felt like it was a decision that we could lower our risk. We acquired a catastrophic insurance. And so we were able to cut our health insurance plan significantly, but still allowing our employees to have a great plan.
Right.
And we feel that it was a very progressive, savvy decision, a tough decision, but one that is so far paying off.
That's really cool.
So I believe you have to be willing to be progressive and make decisions like that.
Right. And kind of go with the flow of what your organization needs specifically.
Absolutely.
And I bet that helps with employee retention.
It does, especially when they utilize our pharmacy.
Right.
And because our pharmacy, when you utilize it, you pay no copay. There were great benefits there within our pharmacy because our 340B pharmacy lowers the cost of medications.
Yeah.
So I think leaders, not only in the healthcare industry, but even outside the healthcare industry, have to think, what is it that's different? What is it that's unique?
Right.
What is it that's going to allow us to step out there and be more progressive? And sometimes that doesn't come very easy.
Right. Yeah. I think it depends on the personality of the leaders.
It could. It very well could. You know, I come from a military background, and sometimes you're having to think outside the box,
Right.
Intentionally, and sometimes it's unintentionally.
Right.
When you have other people's lives that are depending on yours, which is different from the current model as a leader, but when you're out there and you're in an austere environment and someone else is depending upon you, sometimes you have to think outside the box really quickly.
Right.
Yeah.
Okay. So you have the experience to do this now, and that's perfect.
Yes, it's definitely been I've been a healthcare administrator for a very long period of time.
Yeah.
Just a lot of that experience was within the military.
Yeah.
And although you would think that it's quite different, it's actually quite the same. Managed care, we manage the same things. The only big difference is that I might be providing healthcare administration in a jungle, or in a swamp, or in a desert.
Right.
But the echelons of care of what you provide throughout potentially a battlefield is no different than what you would do here in a metropolitan city or a rural type of community.
Right. Yeah. At the end of the day, it's all about people's health and their lives still
Absolutely.
the same. Okay.
Absolutely.
So what would you say is one of the hardest lessons that you have had to learn throughout your career?
That's a very good question.
I come up with these beforehand.
Yeah, you obviously have done your homework. You know, what I would have to say to that is that at some point in my career, I didn't have very good negotiation skills. Being in the military is either yes, sir, no, sir, I got it. You move out smartly and you accomplish whatever it is.
Right.
You don't need to negotiate.
Yep.
I don't need to bargain with anyone. I just go complete the mission, and if it's one of my soldiers, it's very directive in nature.
Right.
And so I needed to learn negotiation skills because in the civilian sector, it's a lot of times about relationships.
Right.
It's about how well you can relate with people, how well you can sit down like we are and have a conversation. And at some point, you negotiate a term that's successful for both parties.
Right.
And so over the course of the time, I've had to really, really learn negotiating skills. So for me, that was probably my toughest. But we've been able to remove $1.4 million of expenses from contracts from me renegotiating contracts.
That's huge.
And, a contract may be favorable for someone else. We're in a capitalistic society.
Right.
So quite naturally, they're going to make the contract to where they make a good profit. But that might not be what's best for our organization. And so you have to renegotiate those contracts.
You have to find the win-win.
Right. Without burning the bridge.
Right.
Without anyone being upset. We're happy. We still love each other.
Right.
It's just that we need to make sure it fits both of our intent.
Exactly.
And sometimes that's difficult.
Negotiation, $1 million skill.
Yeah.
How does one learn negotiation? How did you learn negotiation?
That's also a very good question. So after being in the Army for 10 years, I left the Army and I worked for GlaxoSmithKline Pharmaceuticals.
Yeah.
And so as a pharmaceutical sales rep, I couldn't just walk into the doctors being very direct out of the military.
Right.
I had to learn to be able to conversate and speak technical, but in a really relaxed, comfortable way. And so because of that, I believe I began to naturally learn negotiating skills. Pharmaceutical sales is somewhat of a soft sale. It's not going in, kicking down the door, asking them to buy this, closing the deal, and being rewarded. It's a lot about still a relationship.
Right.
Being able to acquire a little bit more time to speak with that provider,
Yeah.
education, understanding technical competence of certain medications. And with that, you begin to develop a rapport that you can negotiate different avenues of approach with that provider. And so I think that subconsciously, that opportunity of working there for about 4 or 5 years really helped me with my negotiation skills.
Awesome.
And of course, there are things that I did along the way that were very specific to negotiating skills.
Yeah.
I think a lot of people don't realize how important that is. They think that automatically is assumed because of their personality, but it's definitely a lot more technical than that.
And it's a learned skill.
It is.
And there are many books on it.
Yes, there are.
Perfect. Well, we're not going to take up too much longer. I know that people have a very short attention span. Do you have any announcemements or anything that you would like to share?
I appreciate the opportunity. I think that this is great that you can identify leaders across the community that speak about things that may be specific to what has allowed them to be successful. I think that's great.
Awesome. Well, thank you so much. How can people find your website?
Yes, Heart of Florida Health Center's website is myhfhc.org. We have all of our information for all of our sites. We have 10 different sites spread out across Marion County, from Denellen all the way to Reddick. And we see just about every type of discipline in primary medicine, between adults, pediatric, dental, behavioral health, as well as case management.
And their pediatric dentistry is actually one of the very few sites in Ocala that takes Medicaid, just FYI.
Absolutely.
Well, perfect. Thank you so much, Jamie. This has been another episode of Business Secrets Revealed, and I'll catch you next time.